Thank you for being here today. It is an honor to stand in the Canada's Press Gallery during Vision Health Month to deliver a message that is urgent, evidence-based, and ready to be acted upon. I am Jennifer Urosevic, Chair of the Vision Health Partners Coalition and President and CEO of Vision Loss Rehabilitation Canada. Joining me here today representing the coalition is Leslie E. from the Canadian Council of the Blind, Elisabeth Fowler from the Canadian Ophthalmology Society, Dr. Alison Scott from the Canadian Association of Optometrists, Diane Bergeron from CNIB, Jennifer Jones from Fighting Blindness Canada. I would also like to acknowledge our coalition members not with us today, Robert Dalton from the Canadian Association of Opticians, and Lisa McKeon from Orbis Canada. Together we represent the full continuum of vision health in this country, from prevention to clinical care to rehabilitation to research and lived experience of millions of Canadians. We are here because we have a message for the federal government. The tools are in place, the strategy exists, and Canadians are waiting. Now it's time to act and invest. More than 2.2 million Canadians currently live with a visual impairment. Millions are at risk of conditions that are preventable and treatable. Vision loss touches every stage of life. Children with undetected vision problems struggle in school. Working age adults lose productivity and economic dependence. Older adults facing vision loss experience falls, isolation, and loss of independence as that they work their whole lives to maintain. And here is what keeps us up at night. The economic burden of vision loss in Canada was estimated to be $32.9 billion in 2019. If we do not act now, that figure is projected to climb to $56 billion by 2050. This is not a niche health issue. It is a national crisis, including hiding in plain sight. What makes this very hard is to accept that a significant portion of this burden is preventable. Early detection does save sight, yet one in 3 Canadian adults do not follow the recommended eye exam guidelines, not because they don't care, but because awareness is low, access is uneven, and too many Canadians don't know what they don't know about their eye health. The coalition has not been standing still. Over the past several years, we have done something rare in Canada health policy. We aligned across organizations, across disciplines, across lived and professional experiences, and we drove Bill 284. We are proud to report that Bill C-284, the establishment of a national eye care strategy, a private member's bill, was brought forward by the Honourable Member of Parliament Judy Sgro, passed in the House of Commons and cleared through the Senate, and received royal assent in November 2024. This is not an achievement that one single organization can do alone. This is a result of a unified voice. Every member of this coalition testified, engaged MPs, shared data, and brought forward real stories of Canadians living with sight loss. The National Strategy for Eye Care is now law in this land. This is historic. But we know that passing this law is only the beginning, and the real implementation starts now. And the implementation starts with investment. I pass it over to Leslie.
Today, we are calling on the federal government to take 2 immediate, feasible, and cost-effective actions to activate the National Strategy for Eye Care. Recommendation 1, invest $10 million over 5 years in a national public awareness campaign. Consider this. 97% of Canadians say eye health is important to them, yet 1 in 3 adults is not getting regular eye exams. That gap between intention and action is exactly where a federal awareness campaign can intervene and save both sight and money. A national campaign should focus on 3 priority populations that align directly with existing federal priorities: children and school readiness, Undetected vision problems affect learning and development. Early detection is everything. Working wage adults, digital eye strain, preventable conditions, and lack of awareness are reducing productivity and workplace participation. Older adults, vision loss accelerates loss of independence and drives up healthcare utilization. Supporting healthy aging means supporting vision health. This campaign we are recommending to be built on 5 evidence-based objectives: promoting proactive eye health behaviors, increasing awareness of the importance of regular eye exams, increase awareness of the range of professionals who provide vision health services, reducing the stigma associated with vision loss and blindness, and assuring people with vision loss can access the interventions they need to live independently. All campaign materials will be accessible: Braille, large print, audio, digital, and multiple languages, including Indigenous languages. This is a campaign for all Canadians. $10 million over 5 years. That is less than 1/3 of the percent of the projected economic burden by 2050. This is not a big ask. It is a smart one. Recommendation 2. Establish a strategic steering committee to oversee implementation of the National Strategy for Eye Care. A national strategy without coordinated governance is a strategy that fails. We are asking the federal government to establish a strategic steering committee, one that brings together people with lived experience, vision health professionals across the full care continuum, researchers, community-based organizations, and vision health leaders. This is how we ensure that the strategy works in practice, not just on paper. It is how we achieve consistent progress, evidence-based decision-making, and real alignment with provincial and territorial partners. These 2 recommendations are low risk, cost-effective, and ready to implement within the current government context. They were developed together by our coalition, grounded in evidence, shaped by lived experience, and submitted formally to the House of Commons Standing Committee on Finance. I'll now pass it over to Liz.
Je veux prendre un moment pour parler de quelque chose qui va au-delà des chiffres budgétaires, la coalition qui soutient ces recommandations. Ce qui rend la coalition des partenaires en santé visuelle si puissante, ce n'est pas seulement les organisations réunies autour de la table, mais aussi notre façon de travailler ensemble. Nous nous engageons à privilégier l'impact collectif avant les priorités organisationnelles individuelles. Nous avons eu des conversations franches sur les aspects où la collaboration est facile et ceux où elle est plus difficile. Nous avons harmonisé nos efforts de plaidoyer, coordonné notre mobilisation auprès des partenaires fédéraux et bâti un climat de confiance entre des organisations qui, auparavant, travaillaient en parallèle. Et grâce à cette approche unifiée, nous avons réussi à faire adopter le projet de loi C-284. Nous avons soumis des recommandations coordonnées à Santé Canada après son adoption. Et aujourd'hui, nous nous présentons ensemble, non pas comme des intervenants concurrents, mais comme une seule coalition avec un seul message. Ce message est le suivant. Le Canada a une occasion unique dans une génération de transformer les résultats en santé visuelle pour des milliers de personnes. Au gouvernement du Canada, nous disons ceci. Les Canadiens ne devraient pas perdre la vue parce qu'ils ne savaient pas que leurs conditions pourraient être évitées. Les enfants ne devraient pas prendre du retard à l'école parce qu'aucun problème de vision n'a été détecté assez tôt. Les personnes âgées ne devraient pas perdre leur autonomie parce qu'elles n'ont pas pu accéder à des services de réadaptation en temps important. 10 millions de dollars sur 5 ans pour une campagne nationale de sensibilisation. Un comité directeur stratégique pour guider la mise en œuvre. 2 mesures concrètes qui permettront de préserver la vue, de réduire les coûts et de démontrer aux Canadiens que ce gouvernement prend la prévention au sérieux. Aux journalistes présents dans cette salle aujourd'hui, la perte de vision est une question d'équité. C'est une question d'accès. C'est l'histoire de ce qui se produit lorsqu'un système de santé est fragmenté et sous-financé. Et maintenant, pour la première fois, c'est aussi l'histoire d'une stratégie nationale inscrite dans la loi et d'une coalition qui demande au gouvernement de la financer. Jennifer.
In closing, over 8 million Canadians are living with a vision condition that could lead to vision loss. Many of those cases are preventable and treatable. The National Strategy for Eye Care gives us the framework. Our coalition gives us the expertise, the lived experience, and the united voice. Now we're asking for the federal government to make the investment. If we continue to work together with purpose, with trust, and with a shared commitment to Canadians we serve, we have the opportunity to fundamentally change vision health outcomes in this country. Thank you. Are there any questions from the room?
There are no questions at the moment. Il n'y a pas de questions pour le moment. Is there something you would like to add to your statement? Est-ce que vous aimeriez ajouter quelque chose?
Yeah, the last statement I'd like to say is that we have been working with Health Canada for the last 18 months, providing voices, providing information, and we're ready to see what the implementation of this strategy looks like.
Thank you. This concludes the press conference. Merci, c'est ce qui met fin à cette conférence de presse.